up in the morning, you may take a shower, wash your hair, brush your teeth, so you look your best. In the process, you also rid your body of many tiny organisms and viruses that can cause disease. Although they are much too small to see, they are all around you and they can pose a serious threat to your health. A disease is an illness. There are two main types of diseases. A communicable disease is a disease that can be passed to a person from another person, animal, or object. A pathogen, or disease-causing agent, spreads communicable diseases. Pathogens come in 5 different forms. A virus is the smallest disease-causing pathogen. A virus is non-living, but it reproduces by infecting certain body cells and then directing the cells to make more copies of the virus. Examples include colds, flu, measles, chickenpox. Bacteria are single-celled microorganisms that live nearly everywhere. There are more than 1,000 kinds of bacteria, but only about 100 are known to cause disease. Bacteria cause diseases such as strep throat, tuberculosis, and Lyme disease. Rickettsia are pathogens that's similar to bacteria, but multiply like viruses. Rickettsia are much smaller than bacteria. A disease that causes from rickettsia is the Rocky Mountain spotted fever. Fungi are single-celled or multi-celled organisms that feed on organic material. Fungi include yeast and molds. Fungi can cause diseases of the skin, mucous membranes, and lungs, including athlete's foot, ringworm, nail infections. Protozoa are single-celled organisms more complex than bacteria, some of which cause certain diseases, including malaria and the African sleeping sickness. One common type of pathogen, prions, are not viruses, bacteria, fungi, or parasites. Prions are simply infectious proteins. Prions enter cells and convert normal proteins inside the cells into prions. Prions became known to the public when mad cow disease occurred. You come in contact with most pathogens through contact with other people, pets, or other animals in contaminated surfaces or objects. This contact may be direct or indirect. Contact with people. The most common way for pathogens to spread is through direct transfer from an infected person to a person who is not infected. Actions such as shaking hands with an infected person and then rubbing your eyes or touching open sores on an infected person can spread pathogens. Contact with objects. Handling objects used by an infected person is a less direct but effective way of spreading pathogens. If you use a pencil, a toothbrush, an eating utensil, clothing, or a doorknob used by an infected person, you may pick up pathogens. Contact with animals or insects. The bites of infected dogs, cats, raccoons, bats, and other animals can transmit the rabies virus. Mosquitoes can carry pathogens that cause malaria. Animals and insects can also carry pathogens from one place to another. Mosquitoes thrive in warm, wet environments. In 1999, the first known case of the formerly tropical West Nile virus was discovered in the United States. Transmission through the air. An infected person's cough or sneeze can release pathogens into the air. A person who inhales these pathogens may become infected. Transmission through food and water. Laws require workers who handle food to wash their hands with soap and water after using the restroom to prevent the spread of pathogens to food. People should also wash their hands after coughing or sneezing. Pathogens can also grow in foods and cause foodborne illnesses. Drugs that can cure many bacterial diseases are called antibiotics. An antibiotic is a substance that kills or slows the growth of bacteria. Some bacteria, however, have developed resistance to antibiotics. This means that the drugs are no longer able to destroy the bacteria. Resistance develops over time as bacteria are exposed to antibiotics. Most of the bacteria die, but the strongest ones survive and multiply. This is especially likely to happen at low doses, which kill fewer bacteria. The misuse of antibiotics to treat viruses has also raised humans' resistance to the drugs. The widespread use and overuse of antibiotics and medicine in agriculture has contributed to the problem of resistance. In the past, stronger antibiotics were developed to replace those that ceased to be effective. Effective antibiotics are now harder to develop. Personal care products, such as antibacterial soaps, can add to the resistance problem. Some bacteria may develop a resistance to the antibacterial agents these products contain. There are some common sense behaviors for preventing the spread of communicable diseases. The best place to start is with good hygiene. You probably follow many hygienic measures already. Protecting yourself from disease starts with hand washing. Wash your hands frequently and always wash them before eating or handling food and after using the restroom. Bathe or shower daily. Make sure surfaces and utensils used for preparing food are clean and do not share eating utensils or drinking glasses with others. When outdoors, wear appropriate clothing, such as long pants and long sleeve shirts, and use insect repellent to protect yourself from ticks and mosquitoes. Examine your body for ticks after you've been in wooded areas or areas with tall grass. If you are bitten by a dog or other animal, even a small animal like a mouse, be sure to see a physician right away to prevent infection or illness. You can always protect others from pathogens by taking a few simple precautions. Washing your hands frequently will protect others as well as yourself. If you are ill, find out how long your disease will be contagious, that is, able to be spread from person to person. Staying home from school and avoiding other people during this period will reduce the risk of spreading pathogens.